Hello, thank you for virtually stopping by. I'm Kerry and I will be presenting work conducted while at Stanford School of Medicine with the Pediatric Neurostimulation Laboratory, headed by Dr. Fiona Baumer. And I am now a PhD student at the University of Pennsylvania in the Neuroscience graduate group. So language is left lateralized in most right-handed adults, and lateralizing language is important both for the clinical evaluation of neurosurgical candidates and for studying language processing. The most established methods to do this are fMRI and MEG. fMRI maps language based on elevations in blood oxygen level dependent or bold signal, and MEG is a newer modality that identifies language cortex by measuring changes in magnetic field elicited during language tasks. MEG identifies decreased beta frequency band, or 13 to 30 hertz power, which is amplitude squared, in the left inferior frontal and superior gyri, as well as increased power in the matched right hemispheric regions. Bold signal elevations have been correlated with decreased power on MEG, suggesting the reduction in power measured by MEG reflects increased metabolic demand in the underlying neural population. The right hemispheric power increases are hypothesized to reflect neural inhibition. Both fMRI and MEG require highly specialized and costly equipment and can be difficult to tolerate, especially for children and for patients with neurological disorders. EEG has greater temporal specificity than fMRI and is more available than MEG, but its capacity to determine language lateralization is less clear. An early study found lateralized EEG responses using verb generation, a classic word retrieval task that elicits lateralized fMRI and MEG responses. The authors identified lateralized event-related potentials, ERPs, which are reproducible perturbations of EEG amplitude, that occurred early in the temporal and later in the frontal region during verb generation, but were absent during passive listening or repetition. But there are some problems with ERP analyses. They can miss brain signals whose timing varies across trials due to averaging. In contrast, time frequency analyses, looking for spectral power changes from baseline, can detect responses that have variability in onset, as could be expected in language tasks. Surprisingly limited literature explores the feasibility of using EEG time frequency analysis to lateralize language. So the main purpose of our pilot study is to test if spectral features measured by EEG lateralize language. To do this, we recorded EEG on healthy right-handed English-speaking adults as they participated in covert verb generation and two control tasks, word listening and repetition, and calculated the event-related spectral perturbation, ERSP, a measure that highlights task-related changes in power from baseline. Positive ERSP values, called event-related synchronizations, indicate increased power from compared to baseline, while negative ERSP values, called event-related desynchronizations, or ERD, indicate a decrease from baseline power. We invited right-handed adults with English as their first language to participate. Exclusion criteria included history of prematurity, or less than 37 weeks gestation, epilepsy, brain injury, neurosurgery, or medication use. We recorded age, sex, score on the Edinburgh Handedness Inventory, and knowledge of other languages. The study was approved by the Stanford University School of Medicine IRB, and participants provided informed consent. Now, to acquire data, we recorded EEG while participants sat in a comfortable chair facing a computer monitor with speakers on either side. EEG was recorded with 257 channel saline caps from EGI with a sampling rate of 500 hertz. Participants completed 3 tasks: covert verb generation, passive listening, and repetition in separate blocks. And we had 2 blocks of verb generation and 1 each of listening and repetition. Block order was randomized per participant. Each block consisted of 60 trials, each of 9 seconds, for a total experimental time of about 1 hour. For each trial, begins with a fixation cross on the screen while baseline EEG was recorded. Then a noun was played via speakers. Separate word lists of concrete nouns balanced for word frequency and length were used for each block, adapted from a prior experiment. A noun presentation lasted between 500 and 1,000 milliseconds. During verb generation, the participants were asked to think of a verb associated with that noun. And then after 3 seconds, a tone was played, indicating the trial's end. After this tone, the participant stated the verb to confirm engagement. During repetition, meanwhile, the participant repeated the noun after the tone. And during passive listening, the participant sat quietly. Before each block, the participant was prepared with written and auditory instructions, as well as practice stimuli. We pre-process data using the semi-automated artist pipeline, and feel free to ask questions about that in the Q&A. We calculated time frequency representations of EEG using Field Trip Toolbox in MATLAB, applying a sliding window spectral analysis with Morlet wavelets to each 4.9 second epoch of cleaned EEG. And then we log transformed this average power spectra and subtracted out the log of baseline power from the task power to generate the ERSP, which is the log of the ratio between task and baseline power. So once the ERSP was calculated for each electrode, frequency bin, and time point, we reduced the data to focus on specific components of interest as follows. So we averaged across frequency bins to derive ERSP for 4 frequency bands: theta 4 through or 5 through 8 hertz, alpha 8 to 13 hertz, beta 13 to 30 hertz, gamma 30 to 50 hertz. And then, so we chose these canonical frequency bands because of prior studies of language processing have used them. And we, based on prior work, we also were looking at 3 regions of interest: the inferior frontal gyrus, superior temporal gyrus, and occipital region. And we refer to these as the inferior frontal region, superior temporal region, and occipital region. So we first assessed if the ERSP during verb generation differed significantly from 0 in any ROI or frequency band using 1 sample t-tests. And we used Bunfaroni correction to account for the 4 frequency bands tested. So we look at significance threshold of less than, P is less than 0.0125. Our hypotheses included, we expected ERD in the left inferior frontal and left superior temporal regions, ERS in the right superior temporal region, and no change in the right IF or bilateral occipital. And we also tested if control tasks elicited either significant power changes from baseline or asymmetry between hemispheres, employing 1 sample and paired t-tests respectively, with a 2-sided significance threshold of 0.0125, as previously described. We next assessed for asymmetry and spectral responses between hemispheres, comparing the ERSPs and matched left and right ROIs using paired t-tests. And we present an asymmetry score, which is the right minus left ERSP. So a positive AS indicates right hemisphere ERSP as more positive than left. And we expected significant asymmetry in the IF and ST, but not occipital regions. And we also didn't expect asymmetry during repetition or passive listening. And next, we have a few more. So we're looking at replicability between verb generation blocks. We tested if spectral responses were replicable by testing these 2 verb generation blocks separately and seeing how the results compared with each. So for each of them, we expected the same things as before. We also divided the task period into an early and late block to test temporal specificity of responses, taking advantage of the great temporal specificity of EEG. And for these, we expected early left temporal and late left frontal ERD, and early right temporal ERS. And we didn't expect any differences in the occipital regions between early and late. Now, we finally examined whether spectral changes from baseline or asymmetry between hemispheres were detectable at an individual level. And we finally tested if the magnitude of the ERSP or asymmetry score correlated with age or handedness using Spearman's correlation coefficient, or differed based on sex, male or female, or bilingualism, yes or no, using the Mann-Whitney U test. Now, what are the results? Okay, now number 1, was the ERSP during verb generation and control tasks different from 0? So that's looking for ERS or ERD, or changes from baseline. So this figure is on figure A, is showing the average left and right ERSP, the group average, over time during verb generation by frequency band in the columns and regions of interest in the rows. The y-axis, the black line here, represents initiation of auditory noun presentation. And the baseline is 250 to 50 milliseconds prior to auditory noun presentation, which is off the chart right here. The left solid vertical line represents the beginning of the analyzed task period right here, which extends from 750 milliseconds through 3000 milliseconds. In figure B, the plus sign indicates region of interest that demonstrate a significant change in power from baseline, so ERS or ERD. And shaded bars, like right here, indicate asymmetry between homologous ERSPs. And the significance thresholds for both of these are below 0.0125 for a p-value. And so from this result, we see from verb generation, there were, so we see there's asymmetry in the beta band in the inferior-frontal region and asymmetry in the alpha band in the superior temporal region. And then we see ERD in the left inferior-frontal beta band. And then we see ERD in the gamma bands in left and right for the inferior-frontal region and occipital region. In control tasks, we did not see any ERD or ERS, but we did see significant asymmetry in the beta band in the occipital region. And that was during passive listening, but not during repetition. And so we also included this chart because we delineated cutoffs and frequency bands, and in our averaging, we also wanted to show the full spectrum of ERSP across frequencies. And so here we have time frequency plots of group average ERSP across regions of interest for verb generation, repetition, and passive listening. And time since noun presentation is represented on the x-axis, and frequency is represented on the y-axis. For each of the three tasks, the left column represents the left hemisphere ERSP, the middle column the right hemisphere, and the right column the asymmetry score. And for the ERSP plots, the red indicates an increase in log power, ERS, and blue indicates a decrease in log power, ERD, from baseline. For the asymmetry score plots, which is this right column here, here, and here, red indicates the log power change from baseline was more positive in the right versus left hemisphere, and blue indicates that the log power change from baseline was more positive in the left than the right hemisphere. Okay, now was there replicability between verb generation blocks? So we do see left inferior frontal beta ERD and alpha ST asymmetry when analyzing each verb generation block separately. So here, it's consistent, and this left ERD here is consistent, as well as diffuse gamma ERD in most ROIs. There are a couple differences where we don't see the asymmetry in the second block, where we see it in the first, and then also in the superior temporal, there's no gamma ERD in the right superior temporal in the second block, while there is in the first. So we also wanted to see if we could use EEG's temporal specificity to detect differential early versus late responses that have been previously reported in language processing studies. And we did see significant left beta inferior frontal ERD only in the latter part of the task period, though a significant asymmetry between the two inferior frontal regions was noted in the earlier time window. The superior temporal alpha asymmetry was significant in both early and late segments, but the magnitude was larger in the earlier time window, a little bit smaller in the later. Now, were these changes detectable at the individual level? We explored whether frontal beta or temporal alpha responses were consistent across individuals. So here, we have 16 of 20, or 80% of participants showed left inferior frontal ERD in the beta band, and 65% showed right inferior frontal beta ERD. 14% or 70% showed relatively higher beta power in the right versus left frontal region, so an upward slope here. And 13 or 65% participants showed both a positive AS, or a relatively higher right beta band, and decreased left IF beta power, so negative here and positive slope here. Now, superior temporal region, in the alpha band. 11 of 20, so 55% of participants showed left superior temporal alpha ERD, about half, and 14 out of 20, or 70%, showed right superior temporal alpha ERS, more than half, 70%. Now, 16 or 80% showed a positive AS, meaning an upward slope between the left and the right, indicating relatively higher alpha power in the right versus left superior temporal regions. Now, 90% of subjects demonstrated either left IF beta ERD, or a negative point here, or an alpha ST positive asymmetry score, or an upward slope in the right plot. And finally, we also tested if ERSP, or asymmetry score, magnitude correlated with age or handedness, or differed based on sex or bilingualism. We found that these characteristics were not significantly associated with spectral responses in the IF beta band or the ST alpha band of hemispheric asymmetry. So this study suggests spectral analysis of EEG can identify language lateralization. Now, when compared to baseline, the left frontal region showed decreased beta power, or ERD, and all regions showed gamma ERD. Furthermore, verb generation elicited significant asymmetry between frontal beta responses and temporal alpha responses, and frontal and temporal changes in power or asymmetries were not evident in language areas during control tasks. MEG studies also identify left frontal beta ERD during verb generation, which is thought to reflect increased demands on verbal working memory. And more generally, MEG and EEG spectral analysis studies have associated beta changes with higher order linguistic processing, including word discrimination, semantic unification across a variety of language tasks and brain regions. Alpha and beta ERD likely signify increased regional metabolic demand, as they correlate with increased fMRI bold signal. Now, we speculate that left IF beta ERD may reflect demands on verbal working memory, and fittingly, we note that beta power decreases, though not significantly so, during repetition, but not during passive listening. And repetition seems to have would have an increased demand on verbal working memory than passive listening. Now, possibly the frontal beta ERD reflects activation of regions associated with motor preparation, and that's been previously described extensively. But if the beta ERD represented solely motor processes, we would expect it to be of equal magnitude between verb generation and repetition tasks. And we don't see that. And so we posit that either verbal working memory load or perhaps attentional processes contribute to the spectral change. So these hypotheses could be tested in future studies. Now, we also found significant reduction in gamma power across language and occipital regions during verb generation, but not control tasks. And some authors have reported passive listening elicits changes in high gamma activity in left temporal and frontal areas on intracranial recordings. Unfortunately, it's particularly challenging to detect high gamma with scalp EEG due to low amplitude and contamination with high frequency muscle artifact. Now, we might miss on high gamma activity with our current methodology, and that's why we focus on lower gamma. So past studies have shown gamma, ERD in bilateral angular gyrus and occipital cortex, as well as left lateralized regions during syntactic processing task, mental verb conjugation into past tense. And the gamma ERD we observe during verb generation may reflect these syntactic skills, like word order, that are not engaged during control tasks. However, gamma changes might also signify cognitive processes common to all tasks. And this other result that we find is this temporal alpha asymmetry. Now, we think that temporal alpha asymmetry may reflect active inhibition of right temporal regions paired with release of inhibition in left temporal regions. And the right alpha ERS may reflect functional inhibition of task irrelevant cortical areas correlated with working memory storage demands and task performance, as has been found in past language processing studies. The left alpha ERD, we think, may reflect word level memory and syntactic processing. And the verb generation, we think, might be demanding enough to detect asymmetric ERSP between hemispheres, but not demanding enough to elicit significant ERS or ERD in either hemisphere. So several limitations for a study merit discussion. In this pilot, we did not obtain imaging like MRI, fMRI, to confirm left hemispheric language lateralization. However, we tailored our inclusion-exclusion criteria to mitigate this issue because there's pretty good concordance between right-handedness and left lateralized language. In addition, we might not have identified the best time window or frequency band to lateralize language. We averaged over fairly long time windows, even though EEG can be more temporally specific. We did this as the noun stimuli had some variability in duration, but in the future, more restricted word lists could be used to study more specific temporal changes. Further, we correct for the number of frequency bands, but not the number of regions, because we had a priori hypotheses based on MEG literature about how each region would respond. But if we applied a more stringent correction, the results that would remain include the superior temporal alpha asymmetry, and the bifrontal and bioccipital gamma ERDs would remain significant. However, the frontal beta ERD findings would no longer clear the bar. And as frontal beta ERD has been reported in the MEG literature, it might still be reasonable to explore how reliable these frontal changes are that we observe in future EEG studies. And further, so given our small sample size and our subjects were right-handed and healthy, it'd also be important to replicate findings with a larger sample size and assess if this technique could be used to lateralize language in individuals with neurological disorders, as well as those who are left-handed or ambidextrous. So we're excited about this because the current language lateralization modalities rely on expensive, highly specialized equipment, and it can be difficult to tolerate. There is a clinical need to develop readily available, minimally invasive alternatives, and our study suggests that spectral analysis of EEG could be developed into a clinically relevant lateralization technique. Similar to MEG, the majority of participants had left frontal beta ERD, as well as asymmetry between frontal beta ERSPs with right greater than left. And 70% had both the frontal ERD and temporal asymmetry. 90%, 18, had one of these two findings. So in this exploratory analysis, we utilize the mean ERSP and mean asymmetry. Also, future studies should investigate what specific cutoffs for these values could best capture lateralization. Now, future directions. We are conducting this experiment with children to see if time frequency analysis of HD-EEG can detect language lateralization in children. And we are working on other analysis techniques that can be applied to high-density EEG, including connectivity metrics. And our ultimate goal is to see if epilepsy seems to affect language lateralization and if this correlates with clinical scores of language. Now, thank you so much for listening, and I hope to see you in the chat on Saturday. I'm at 6:30 p.m. local time